last time, about I think a month ago, 6 weeks ago, I posted a video about the differences between the different types of lower face neck surgery, and that seemed to have reached a reasonable audience, and there were some good questions and feedback from it. So I want to continue that and explain a few other things as if I'm explaining it to a patient, because I think this hopefully will clarify with data and facts without a lot of marketing hoopla. Okay, I really am trying very hard to make sure that I give factual information, and what you want to do with it is up to you, because I find one of the things that is very confusing for patients, because of seeing so many patients, is that there's a lot of opinions and lots of distractions of marketing mumbo jumbo. So I want to just cut through all of that and just basically give a simple explanation of few surgical procedures. Okay, so since last time I spoke about the lower face and neck, today I'm going to speak about the eye area, because one thing I want you guys to understand is that when people talk about what we call a facelift, it's not the entire face, which is the first misnomer. Okay, it should never be called a facelift, because nobody ever does the entire face at one time, hardly. When people talk about a facelift, as I said in the last video, is usually the lower face and the neck portion. And in some cases it could be only the lower face. Some people call the neck a neck lift, so confusion of terminology. But don't call specific general terms like facelift, because in today's world that doesn't really exist. Every part of the face needs to be treated differently. So what are the different parts of the face? Okay, eyes could be considered one part of the face, and they could be subdivided into upper eyelids and lower eyelids, because they are different operations and they need different solutions. The brow, when it kind of goes down, you can have to lift up the brow. That is called a lateral brow lift, because you're only working on the outside part of it. Of course, there are central brow elevation as well, which is rarely done, if at all, these days. This used to be a bit more popular in the day, but we don't need to get into the confusing aspects, because I'm not going to try to distract you guys. I'm going to focus on the eyes, but I'm giving you a general overview. Okay, so brow is a separate operation, whether it's lateral, central, or the entire lateral and central, that could be considered a different operation. Okay, the mid face is a different part of the face, because this lateral face generally doesn't cover what we call the mid face, which is right next to the nose. This may require volume, this may require some surgical elevation, whatever, but that is not typically considered part of what we call the lower face and neck lift surgery. And mouth area is another area people always talk about. People often have these vertical lines, and people think that if you do a facelift, that's going to get better, but honestly it is not going to get better, because you cannot pull skin tight to make this lips smooth. You have to do other things for that. So don't get confused in all of these things. Okay, that's the very first thing, is be specific about the anatomical region that we're working with. All right, the second thing I want you guys to understand before I get into the eyes is the fact that nowadays we do a lot of combination treatments. Okay, back 10, 15, 20 years ago, there were not very many options available for patients, or doctors for that matter. There were no machines, or very few. There were no fillers. Fat grafting was not that popular. There were not adjunctive treatment or therapeutics available, and therefore everything was about surgery and surgery and surgery. Well, surgery can only do so much, right? So now, with advancement of techniques and understanding of anatomy and understanding of various beauty aspects, we're able to utilize a combination of different things, so that in one setting you could do a little surgery, you could do a little fat grafting, you could do a little skincare, you could do a little fillers, you could do a whole bunch of different things. And so that's the other thing that we want to make sure that the audience understands, is that surgery is not the end-all be-all solution for things. Fillers are not the end-all be-all, skincare is not the end-all be-all. It's a combination of those things, and therefore, ideally, a practice, a surgeon that has the versatility of offering all of these, so that you're holistically thinking about everything and not just pushing people towards one direction, because that's all they do, is also something for the audience to understand. Okay, so these are some general disclaimers that I want to give everybody. Having said that, let's talk about the eyes specifically. Okay, so as usual, I like to be visual, and I think drawing cartoonish type of figures is probably the best for most people to understand. So if I were to draw, the eye kind of like this. right? So this is obviously the nose. So typically, these are the lashes. Typically, almost always, okay, there's what we call a natural crease in the eye. Almost always, except if you're Asian, where this crease that is naturally formed in almost all parts of the globe, except for Asian or Oriental, it's sometimes called, where the crease is lower. This is a very good landmark for us to work with, okay? And the brow really is up here, right? This is the brow. So when we talk about the eye, or the eye area, we should always consider the brow separate, because you could have brow descent, which is separate from the eye and the eyelid itself. So first thing I want to decipher for you is that this part, which is the brow, comes from the forehead, and then this itself can descend and cause droopiness of the brow itself. Well, that causes the lid skin, which is here, to be heavy, and it kind of is going to come over the lashes and make the lashes crowded and full, and sometimes can even obstruct the side of the eyes like this, okay? So the brow is different and the eyelids are different, but they're interrelated in a sense because they work together, okay? So you cannot confuse a brow surgery with an eyelid surgery. Typically, when you do surgery and you evaluate somebody for problems around the eye, you want to make sure that do they have brow descent, do they have eyelid skin laxity or excess, or do they have both, okay? You have to determine that. And then you analyze, what am I going to do first and why, okay? Do I do the eyelid surgery first, and do I do the brow surgery first, or do I do both of them together? And those are nuances we can go into as we continue to learn about this video. But another thing that I also want you guys to understand is that many times in the eyelid, this crease creates this little fold of skin that comes down here that makes you look like a, kind of sad puppy dog eyes, which makes people very tired looking or sad looking or unhappy looking. And most traditionally, eyelid surgery was taught, and even today, to end it at the end of the, kind of the corner of the eye here, but that misses this skin here. And many times, if you notice surgical patients, they have a nice crease here, but they still have this excess skin that hangs here, which makes all of this area look bad and doesn't look open and refreshed. So if you open up this area, it's going to look a whole lot better than having a very nice crease like this, but then you have this extra skin and extra lines that come across to the side. And this can happen to people who are not surgical patients or people who have had surgery. So oftentimes you can extend your surgical planning where you utilize that natural crease that exists out to the corner like this. Okay, so you can take out all that extra skin on the outside. So without getting too confusing, I hope that's clear. So first and foremost, you have to make sure, do you have brow issues, or do you have eyelid issues, or you have both? And if you have both, what do you address first? Do you address the eyelid first? Do you address the brow first? Or do you address both of them first? And so if you logically think through this, a surgeon should be able to explain to you what works well by showing you what moves, what doesn't move, why this is better, why that's better. So we don't need to go into that now, but that's the thing. And so that's the first explanation. The second thing that people always worry about is how big is the incision going to be. And like I told you, right, again, just to reiterate, if this is the eye, the crease generally goes typically about 8 to 10 millimeters above the lashes. Okay, that's a very natural position of that natural crease. So if you look in the mirror yourself, lift the lid up, you will notice it yourself. So the incision typically has to go, this is the inner of the eye, this is the outer corner of the eye, this is the nose obviously. So the incision has to go all the way across because you have to make sure everything is smooth. And many surgeons, like I said, end the incision here at the end, which is not a good technique in my opinion because it leaves this extra skin a lot of people have. So I typically extend this outward like this here so that I can take out all the excess skin here. So that's the first thing that you do, is to do this, okay? Then you would dissect the skin upward like this as far as you can go because the brow is here, right? I already told you. So you dissect all of this tissue upward. Once you dissect the tissue upward, you have the lid closed, and then you re-drape this skin down, and so the skin is going to come down like this because you've dissected and stretched it almost like a bed sheet. And then once you see the excess skin, right, this is how low this margin now becomes because you dissected it and brought it down, because it's almost like a bed sheet that's wrinkled up. You pulled it down because you have a cut there, and you pull all the tissue down and kind of goes over the eye. Now you make sure that the patient's lid is closed, and then you measure this extra skin exactly at the crease, okay? And then you trim all of this tissue and take it out. So now you know, right, that the length of the incision is going to be like this, and this fits into the crow's feet very nicely and it heals beautifully. All of this extra skin is extra because you have the lid closed before you close it, and you have this cut. So you basically measure that excess and you trim it and you basically throw it out or discard it. And then whatever's left over, you put stitches here, like that. So in an eyelid surgery, that's how long the incision is typically going to be. The excess skin is measured precisely because you're doing it, in live situation where the lid is closed. So we know that, the excess skin is not going to be too excess because when you cut it with the lid closed, the lid can close fully as opposed to cutting it when the lid is open. So that's one way. Then you stitch it up, and then you're essentially done. But another thing that may need to be done is some patients, okay, have fat pockets, in the corner here, maybe here, whatever. Occasionally you go tease this fat out after you dissect and elevate all of this, remove some of that fat. Some cases you do, some cases you don't. And one thing you want to be sure is that if you do take too much out, you get hollowness set up here. And you don't want to do that either, because as people age, you lose volume, and that's no different in the eyelid itself. Eyelid needs to look full and healthy. So if you over aggressively take out fat willy-nilly, then you're going to have hollowness that develops in the next 3-6 months to a year. And as you age, it's going to progressively get worse. So you have to be very careful about removing fat there. You want to be very, very sure that it's not going to create that hollow look. So once that's done, you repair it like I just showed you. One other thing that people need to evaluate is that sometimes the lid margin here, right? I showed you the lid margin with the lashes, sometimes can sit like this, low, because the lid is droopy, okay? People should notice that. If you have a lid that comes down over to the little black circle that people have, which is called a pupil, if it's very low, then you know that the lid is droopy, and in many cases that's also called ptosis. And if you have that, and you have to know that preoperatively, right, in the consultation, you'll have to hike it up as well. So what are the things that we do in surgery like this? And to go over, you remove the excess skin like I showed you that comes down after you dissect it all the way up to here from the lid crease that I drew. You remove the corner skin called the crow's feet skin by extending that incision in a little bit like at an angle like that, and that crease fits into the crow's feet nicely, and the scar is invisible and works very, very well. You also remove or leave fat like I showed you deep inside the eyeball if you need to, but be very, very careful on how much to take out, or actually more importantly how much you leave behind, because you don't want to create hollowness. And the last thing is, if you determine that the patient has what we call ptosis, where the lid margin here, where the lashes are, is not sitting at the top of the circle of the eye, but sits closer to the little pupil, the black dot here, then you know that the lid is droopy, and it's called ptosis, and that may also have to be corrected at the same time. So not everybody needs all of this, right? So the consultation, the surgeon and the patient, you guys have to talk about all of these different things and compare them. And many times there could be asymmetry on one side versus the other as well, because a lot of times, just like all parts of the body have asymmetry, where right hand is dominant, left hand is not so much, right hand is stronger, left hand is not, right breast is bigger, or whatever. There's always asymmetrical kind of structures of the eyes as well. So one eye looks different than the other, and you have to be very careful to analyze that, and kind of may have to adjust for that as well. So this is the eyelid surgery. So typically this surgery can be done under local anesthesia, where you just numb up the area by injecting some numbing medicine there, or you could do it with IV anesthesia. Okay, I do both depending on how the patients are. We give some pills to take, and people are very comfortable with that. Sometimes if they're too anxious, we can also give IV. And we determine that before the surgery, okay? And this surgery to do both eyes in my hands typically takes about 30 minutes per side on average, okay? And whether I have to do any of these, I mean, at a top level, maybe an hour and 10 minutes. On the lower level, maybe about 45 minutes to do all of this work. It's very delicate work. It's very precise work. It's very, very finesse work. And it is something that has to be done precisely and delicately. So because the skin is so thin, so delicate, and so you have to make sure that you don't get too much bruising bruising, you don't, you dissect cleanly so there's not much bleeding, because you don't want to have bleeding in the eye. But typically the surgery is extremely well tolerated. The patients get up and go within a few minutes after surgery. The stitches that are on the eyelid crease that we put in, they typically stay for about 7 days. And at 7 days is the first post-operative visit, which time we take out the stitches. You'll have a little redness of the lid, and the incision will be visible, but over the next 3-4 weeks, 2 to 3 months, it fades quite a bit. And as soon as it heals enough, you can certainly cover up the outer side with some makeup until it kind of blends and kind of quote unquote almost disappears. And this is one of the most effective, predictable, reproducible operations for the face, because it's extremely well tolerated. The pain is very minimal. In many cases, the bruising, it could be there, but not terrible. People can work at home immediately the next day, because most people don't need narcotics. You can take Tylenol or Motrin, which is okay to take. And this heals well, and it's an extremely predictable look that people get, and that takes years off of people's eyes, because, beauty, looking at the eyes, the corners look open. And so I encourage all of you to, hopefully, listen to this once or twice so it makes sense. If you have any questions about this, please post it. I'll be happy to respond via YouTube or Instagram or whatever, because I do find that this kind of information is useful for the audience, and so I'm going to try to continue to post. There's a few of you who have asked me to post about fat grafting and a few other topics, and I'm working on doing those in a very methodical fashion, and I'll be doing those gradually as we go forward, okay? So let's stop it there for now. Thank you.